Alright, let's talk a little bit about the diaphragm, and this one is part of the Breathing Fundamentals series. I wanted to make a series about fundamental practices that can help you with breath work and conscious connected breathing. So the main muscle that we use for breathing is the diaphragm, and it's a dome-shaped muscle that sits underneath your lungs. And most people, when they breathe, they use their upper chest, their neck muscles. And if you really want to learn how to take a deep breath, then you should learn about the diaphragm, because if you take a deep breath and you use your diaphragm, and when you, for example, inhale, the diaphragm stretches all the way, then the oxygen exchange can happen and all your cells get enough oxygen. So if you learn about using the diaphragm, then you can know what a very deep breath is and how you can rejuvenate your cells. Also, I'm going to talk about why people don't use their diaphragm. Most of the time it's because the diaphragm is also plays a role in emotions, and if we have a hard time feeling our emotions, we're of course not gonna use our diaphragm. Also, causes of trauma are there, so that the muscle gets very tight and it's hard to use. So first I will show you a little video of the diaphragm so you have this kind of idea how it looks. So it's a dome shape, and here you see when you inhale it goes down, when you exhale it moves up again. So this is how it looks on the inside, and I'll give you a beautiful exercise that really helps you to feel and connect to your diaphragm. So here we see the diaphragm, and it's also connected to the lower back and the pelvic floor, so it plays a role in core stability. I've had some back problems, and I learned that when I engaged my diaphragm more and trained this muscle, also my lower back problems would get less. So it's a very interesting connection. So actually the normal position is when it's in his dome shape. So for example, when you exhale, the diaphragm is like relaxed, it's in this neutral position. Then when you exhale, it just moves down and you stretch it a little bit. So when we're gonna do the exercise, we actually want to engage our diaphragm, so we want to become aware of it, and we just want to train it and use it more, so more blood flows there and we get rid of the tension. So now we're gonna talk a little bit about why it is that people have a hard time with their diaphragm. So underneath the diaphragm there's like the solar plexus chakra, and there's also a nerve hub. So this area is very sensitive. For example, the vagus nerve also goes there, and the vagus nerve, it communicates your bodily sensations to your brain and to your mind. So also it's also there, like your stomach and your gut. So your gut feeling is also connected through the nerve hub and the vagus nerve and sends signals to your mind. So when we use our diaphragm, we're going to stimulate this area, and also we're going to connect to our bodies more. So we're going to feel our sensations more, because by using the diaphragm, we're stimulating actually the nerves that are underneath. So also the solar plexus is an energy center. So this is about self-worth, about willpower, about our identity. It's also connected to our emotions. So on an energetic level, when we use our diaphragm, we're also going to energetically stimulate this area within ourselves. So if there are psychological problems that we have with these themes, they're going to be activated, we're going to get engaged with them, we can learn something about this area within ourselves. So I always like to look at breathing through different lenses. So with this one, like if you're gonna start using this practice, it's much more than just training a muscle. It can go very deep within yourself and learn something about your self-image and identity willpower, self-worth. So all these aspects are connected to this simple practice of like learning how to use this muscle. And that's also what you see in the next slide, is like, so you do this exercise to firstly become aware of the muscle, where it sits, because like if we're not used to using it, we're not really aware of it. So first is becoming aware of it. Gonna actually train the muscle. So when you train a muscle and stimulate it, the tension can go away, it gets stronger, so your breathing will improve, the oxygen exchange will improve, because you'll actually take deeper breaths, because the diaphragm will move down way further, so there's way more room to exchange gases. Also, when this is very tight and you have a hard time feeling, it will give you emotional release and will get connected to yourself and to your emotions. So when I was making this presentation, I stumbled upon something. Also in photography, it's about the diaphragm, so it's about the dilation of the lens, how much can pass through. And I really thought this was a beautiful metaphor. So you can ask yourself the question, like, is your diaphragm open? Like, is it loose? Are emotions allowed to pass through? Is it okay to connect with sensations and feelings? And of course, if the answer is no, or you have a hard time with this, you can be sure that on the left side your diaphragm is like closed, it's like tight. And we want to move to like an open, flexible diaphragm, so it can move and the nerves can get stimulated, the emotions can flow, and you can start feeling again and connect to your core, to your solar plexus. So that's what it is about for me, and what can really help you in your breath work further. So let's get into the exercise. We're gonna train our diaphragm, and what are we gonna do is that we're gonna breathe in very slowly, and then first we breathe in, then we stretch the diaphragm, it stretches out below, then we hold it there, and then we gently apply internal pressure, so that more pressure gets built up with the diaphragm, so you can actually feel where it sits. Then we're gonna release the diaphragm, and we place it in a neutral position when you have been totally exhaling, so it sits there on top, and we're gonna hold that for a while. So this sounds actually very easy, but if you're not used to it, it can be a bit difficult and hard. I would say just practice, just trying to learn, trying to discover. So when we're breathing in, we're gonna breathe in through one nostril, and the reason we do this is that your lungs are then slowly getting filled with air, and when you do this, the diaphragm slowly moves, and with the slow movement we go slow and deep, and that's what you want to learn. That's how the stretch works. So let's get started. So for the inhale, it's about 3 to 4 seconds, then we hold for about 10 seconds, and then with the exhale also 3 to 4 seconds, and then when you do the exhale hold without air in your lungs, it's about 4 to 5 seconds. This is of course a bit more difficult because there's no air, so you feel like you're kind of grasping for air. You will maybe also notice during the exercise that where your CO2 tolerance is, like how long can you do with air, how much are you over breathing. I'll explore these topics in further videos, but for now we're just gonna like train the diaphragm, stretch it, see where it sits, see how we feel afterwards. So let's get started with the exercise. The last thing is that when you inhale, then after that we do a last push, and also with the exhale we do a last push, and this push is there to give this little extra stretch, and then after that you will hold. So let's first do one practice round, so you go through the motions and then you know how it works, and then we can go into the longer exercise. So you kind of like block off one nose with your thumb or what feels good for you. and then you inhale. Inhale. Then we go for the little push, extra push. Hold it, apply gentle pressure, pull it down, keep applying the pressure, feel into it, gently release the pressure, then exhale, exhale faster, exhale, little push, and then you hold. Try to relax. Try to relax and let go. So sit straight up, make yourself comfortable, relax, and then block one nostril with your thumb. Inhale deeply into your belly, ribcage, chest. One more short sip air in and hold. Gradually apply pressure, pull it down. Feels like you want to exhale, but the air is blocked. Release the pressure and exhale lightly. Stronger, stronger, let it out. Push the air out. Inhale again. Slowly, stronger, stronger, go. Another last sip and hold. Apply the pressure. Push it down. Increase it. Feel into it. Good job. Release the pressure and exhale lightly. Stronger, let go, let go. And a push and hold. Relax into it. Doing a good job. The last sip and hold. And apply the pressure again. Push it down. Yes, you're doing a good job. Hold on. Release the pressure. Exhale lightly. Stronger, stronger, stronger. And a push. And hold. Inhale. Chest more. Last sip in and hold. Build up the pressure. Feel into it. Release the pressure. Exhale more. And a push and hold. See if you can relax under this pressure. Inhale again. More. Last sip in and hold. Apply some pressure. Stay with it. Pushing it down. Relax. Exhale lightly. Exhale more. Thanks for doing the exercise with me. I hope you really enjoyed it. So this was a fundamental practice, and the fundamental practice for me is very important because if you learn to strengthen your diaphragm, this flows into all the other breathwork things that you want to do. And you can do this every day or a couple of times a week. You can even do 1 or 2 rounds. That already helps, and maybe you discovered like, oh, I feel more relaxed now, or there's more oxygen, I feel a little bit more energized. So I hope you experience the benefits of this exercise. If you want to learn more about breath work, or if you can how to integrate this into your daily life, then reach out to me and I can be your personal coach. Okay, until the next video.